at a very early stage, when it is just limited to the cervix, very small thing. Before you get a cervical cancer, we have what we call the precancerous lesions. Precancerous lesions. If you get the precancerous lesions and they are not detected, then they are going to transform into cancerous cells. And this is the importance why you need to be going for pap smear. Right? Now, the treatment depends on the stage. If the cancer is at the precancerous, let's say you have the starting point, the precancerous cells, we can just freeze them. Okay, there are treatments that we can do. Either we use heat or we use freezing, and then we freeze the cells, and it will not allow it to progress. All right. Now, apart from that, also, we can do what we call the abrasion therapy. Guys, let me take some water. Please, everybody, tap on your screen. Tap on your screen, everybody. Thank you, guys. Tap on your screen. Let's take the lights to 150 as I drink water, okay? Thank you, guys, so much. Thank you. Thank you. Thank you. 1,200 people in the house. You are all welcome. If today is your first time joining my live stream, my name is Dr. Felix. I am a specialist medical doctor based in Ghana, and this is all that I do on TikTok. You want a platform where you get good information about your health, diabetes, cancers, non-communicable, communicable diseases, chronic kidney, anything medical. I got you covered. Now I'm here with my amazing moderators. Denise here, you see, is one of them. So Fine for Me is one of them. Humble Lecturer, one of them. I am honest from Uganda, one of them. They are amazing. And as you are here, please, all these people, we are not using treasure box. So these are organic people. Make sure that, number one, for the sake of you coming back for more, please click on my profile picture and give me a follow. If you have not done that, please click on my profile picture and give me a follow. Everybody, let's do this exercise. Click on my profile picture so that anytime I go live, you come here and get value for your data. Don't buy TikTok data and be jumping from box to box the whole day without benefiting anything. Come here, Cochita, I see you. God bless you. Click on my profile picture, everybody. Give me a follow. After that, are you done? There is a bell. Giving me a follow is good. But when you click on my profile picture, there is a bell notification there. Turn on the bell notification so that anytime I go live, TikTok will automatically invite you to come and join Dr. Felix's live. Okay? Do that for me. After that, go to the viewers eye, Mrs. William. That is my mom. Right? Every Sunday, we host a live stream on her platform, Mr. and Mrs. William. Okay? This Sunday, we are going to do part 2 of escaping abusive relationship. Okay? Please click on her profile picture and then give her a follow. What? Something has happened, but I'll not talk about it. I'll not talk about it. I'll not talk about it. Something has happened again, but I'll not talk about it. Let's go on. 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 Can you guys hear me? Please, can anyone hear me? If you can hear me, tell me yes. Can you guys hear me? Yes. Okay. God bless you. Something has happened. Everybody, let's do this. Somebody has sent a report that I won't say it. It's okay. Everybody do this. Do this. Do this. Do this. Do this. Let's take the lights up, everybody. Let's take the lights up. Let's take the lights up. I don't know why, but God is our strength. Let's take the lights up. Let's take the lights up. Let's take the lights up. God is our strength. Let's take the lights up. Somebody has reported that I'm giving misinformation. Just now. But let's go. We will not mind. We will not mind. We will not mind. And guys, I am a specialist medical doctor, right? Everything that I say here, after my live stream, you can go and cross-check. Yeah? And I'm not a Google doctor. I am a specialist. I pay for research so that I can always stay updated. You know, people don't like what I do for humanity on TikTok. So all the time when they see that I'm getting back to my normal views, they try to do all things. But God is our strength. Somebody has reported just now that I am giving people wrong information. Very unfortunate. I don't know what they get from doing that. But thank God, we'll still keep it going. I hope you guys can hear me. Can you guys hear me? Can you guys hear me? I want to continue with the discussion. Can you guys hear me? Yes. Please, if you are with me, type yes in the comment section. Let's go. Yes. Okay. God bless you. God bless you. God bless you. Thank you. Let's continue. So guys, I beg you. Me, Felix, my credibility on TikTok, I don't joke with it. So when I'm coming live, and as a specialist, I put my life on the line to do these sessions for you. So my goal on TikTok, I'm saying it today, I didn't join TikTok. I only joined to meet this gifting. I joined TikTok because I wanted to be giving people information that they don't get access to in the hospital. That is what brought me on TikTok. But because some people think that we are young and they don't like the way we are growing, so all the time they keep sending reports so that TikTok will do what? But God is our strength. Even right now, somebody has done that again. And please, don't worry. I've told them, even if it gets to a point I have only 2 people, I'll still do live stream for those 2 people. Even if I get 2 people on my platform, I'll give them what I need to give them because this is my calling on TikTok, right? God bless you. Let's continue. Now, so we've talked about almost everything. If you are here, guys, I beg you, the women, if the cancer advances, which is the staging that I talked about, then the management becomes very difficult. Why? Even when we do surgery, the surgical options differ based on the stage of the disease. If you have stage 1, where you have this thing, the cancer very small, just around here, about 2 centimeters down there, right? We can do some procedure. One of them is the lip procedure. We can do that. But now, when the cancer progresses stage 3, stage 4, and there, it means that it has spread to even the vaginal wall, all this area, and also the uterine cavity and all that. As a result of that, what is going to happen? We will be forced to take out the whole uterus, known as hysterectomy. Somebody is asking about the course. You came late, sweetheart. We talk about all these things, but I'll do it again. We talk about all that. We have to do a hysterectomy, okay? Sometimes we do hysterectomy and combine it with radiation and also combine it with even chemo. All depends on the stage. But the reason why I'm doing this is not for you to get cervical cancer and go for treatment. My goal is to make sure that I open your eyes to the signs and symptoms of cervical cancer and also the need for you to be going for early diagnosis, early screening so that you can be diagnosed early, quickly. All right? God bless you. Everybody, let's do this on the screen. Let me see something. Okay, let's do this. Let's go. Let's take the lights to 300, everybody. Support me. We are doing this for humanity. for the sake of humanity. That is why I devote my time. And it surprises me how some people on TikTok don't like what I do. Instead of them teaming up so that we do this together, they rather try to do things to do me like this. Oh, human beings. May God have mercy on all of them. May God have mercy on them. May God have all mercy on them. Mama William, God bless you. That is my mom. And on Sunday, we are going to be on her platform. Okay? We are going to be on her platform. God bless you. Everybody help me. Share the live stream, everybody. One more time. One more time. Let's share the live stream, everybody. Don't share to the same people. Okay? Do this. For the sake of humanity. People need platforms like this. People need platforms like this. So, in a nutshell, that is all that I've said about cervical cancer. Let me recap in 5 minutes without any interruption. Cervical cancer is the cancer. Let me change the background, please. Let me change the background to the topic of discussion for the sake of those on the FYP so that they know what I am discussing. Because a lot of people don't come here, but they stay on the FYP. So I normally like to project whatever I'm discussing so that they know what I'm talking about. Okay? God bless you. God bless you. Please keep power tapping and sharing the live stream, please. Keep power tapping and sharing the live stream. This is Dr. Felix and his amazing team of moderators. We are here creating awareness about cervical cancer. We are done with it. Part 2 is going to be on stomach ulcers, which is very, very important. Stay with me and learn about stomach ulcers, right? God bless you. God bless you. God bless you. Mama William, thank you so much. God bless you. Right, so what is cervical cancer? Cervical cancer means that for some reason, the cells around the cervix, which is the doorway to the uterus, they begin to grow, and when they begin to grow, they grow uncontrollably, out of control, and they don't obey the law of grow and get replaced. They keep growing and growing and growing. If that happens, we say that you have cervical cancer. Now, what are the causes of cervical cancer? We have causes and we have risk factors. The main cause of cervical cancer is known as human papilloma virus, simply called HPV. There are up to over 100 types of human papilloma virus. Some causes serious issues, others don't. Okay, the types that causes majority of cervical cancers are known as HPV type 16, HPV type 18, and also, of course, some other subtype that, but type 16 and type 18, they causes about 75% of cervical cancers. All right, so take note of that. HPV is the main one, contributing to about 95% of the total cervical cancer cases. Now, when you break down the HPV, the types, type 16, type 18, they causes majority of the cervical cancers. Then we went on to talk about the risk factors. We said risk factor number 1 is a woman who has multiple sexual partners. I explained why this puts you at risk of cervical cancer. The green, God bless you. Number 2, women who started knacking at a very early stage. Women who started knacking at a very early stage. Please keep power tapping and sharing, okay? Women who started knacking at a very early stage. That can also cause a problem for you, okay? Immunosuppression from any source, and especially if you are living with HIV, okay? This puts you at risk of cervical cancer. Then, of course, we talk about women who smoke. It also puts you at risk of cervical cancer, right? So take note of that as well. Then I talk about recurrent STIs. Example, women who have been getting recurrent gonorrhea, recurrent chlamydia, recurrent syphilis, okay? These are sexually transmitted infections, right? When you get them, they cause inflammation of your cervix, and over time, as your body heals, you get another infection. The inflammation that occurs here can cause some of the cells to transform later into cancerous cells, right? So take note of that, right? Then, of course, we talk about some medication that used to be used. Now we are shelving them. A drug known as diethylstilbestrol, which is, we used to use it to prevent recurrent miscarriages, okay? Diethylstilbestrol. if you receive that medication, it's also been found by research that it puts you at risk of cervical cancer. Then we went on to talk about the signs and symptoms of cervical cancer. I said number 1, pain during intercourse. I don't mean that anytime you have pain during intercourse, you have cervical cancer. It could be because you have cervicitis from STIs, or you have even pelvic inflammatory disease, or you have even a uterine fibroid. But cervical cancer is one of them. Here, I reminded you that anytime you have pain in any part of your body, what it means is that something is going wrong, and therefore, the best thing to do is to go for evaluation to know why you have the pain. Now, my second symptom that I talk about is bleeding during intercourse. Either during intercourse or after intercourse, all of them could be a sign of cervical cancer. So don't take them lightly if you see any of them. Number 3, you have offensive watery vaginal discharge that has blood stains inside. That could be a sign of cervical cancer. You see any of them, do not stay wait longer, all right? Then I reminded the people, the ladies who are in the menopause, women in menopause. You are in your menopause, but from time to time, you start seeing blood, okay? From time to time, you start seeing blood, known as postmenopausal bleeding. That is also not good, all right? Take note of that. It also puts you at risk of cervical cancer, right? So all the women in menopause, if you are in your menopause and you start seeing this blood coming, especially your bleeding stop, you stop menstruating several years back. Now all of a sudden, from time to time, you start seeing spotting, postmenopausal bleeding. Please, that could be a sign of cervical cancer. Another cancer that presents like that in menopause is what we call cancer of the inner layer of the uterus. Okay, this thin layer, known as the endometrium. Okay, known as endometrial cancer, right? That can also cause what do you call it? Present that way as postmenopausal bleeding or bleeding in menopause. Then we went on to diagnosis. I told you that one of the key things to diagnose this is what? Pap smear. And here I reminded you that why are you doing the pap smear? You are doing the pap smear for 2 important reasons. It is a screening tool. We use it to screen cervical cancer, but at the same time also it can be a diagnostic tool. What do? We go inside there, swab the area, okay? This service swab the area, and then we take some small samples there and go and analyze it. We test the swab for the presence of HPV DNA, right? To see whether you have HPV, you've been infected or what, right? Take note of that. Then we analyze the samples under microscopy, the tissue sample under microscope to see if there is any changes in the cell, okay? So take note of that. That is screening tool, is the main screening tool, but it can also become diagnostic based on which stage we are doing that. So that is that. Here I reminded you that you need to start screening as a woman if at any point in time at all, maximum by 30 years. Women who are under 21 years, we don't recommend. The American College of Gynecologists and all that, cancer and all that, they don't recommend it. Pap smear. Most of the associations and then even WHO, they recommend that you start screening at 30 years. Right? However, if you are living with HIV, you start screening, doing your pap smear at 25 years. Right? So take note of that. Here I also reminded you that if you have a child, children are the future leaders. You need to protect them. Okay? So children in most countries from 11 or 12 years upwards, they qualify for vaccination against human papilloma virus. So get your kids vaccinated so that you protect them against HPV. Alright? So take note of that. We also mentioned that we have to practice safe sex, stick to one partner, use protection as much as possible. Make sure that you screen yourself for HIV, gonorrhea, Felix, God bless you. Thank you so much. HIV, gonorrhea, Hep B and C, and then of course syphilis. Before you start doing before you start doing something with your partner, this is very, very important. All right? Is it normal for someone in menopause to feel always heat? Absolutely. It's one of the postmenopausal symptoms because of hormonal changes. Right? So take note of that. Right. Then I also mentioned to you that you have to start doing pap smear. And once you start, the protocol varies from country to country. In some countries, it's 2 years. In some countries, 1 year. In some countries, 3 years. Even in some countries, 5 years. Right? So you have to know your local original protocol for pap smearing. And you don't stop doing pap smear until which year? That is a question to all of you. When are you supposed to stop doing pap smear? I need an answer because I told you guys, which year as a woman are you supposed to stop doing pap smear? I want this to stick in your head. Please, that is why I'm asking you to give it to me. I gave it to you, so I'm just requesting you to give it back to me. Exactly, you guys are learning. I'm proud of you guys. Thank you. We will not mind those people who are still reporting us. We will not mind them. We'll keep giving you best that we know, okay? This is my passion. And if there is anything I know to do on TikTok, this is what I'm doing. God bless you. 65 years. So once you start doing pap smear, you never stop, okay? Until you are once you start doing pap smear, you never stop until you are 65 years. So with all this, we also talk about the diagnosis and treatment. We said that the treatment depends on the stage. If you report early, because you saw the symptoms that I mentioned and you report early, the treatment is easy. You can have your life back and become cancer free. However, if you are seeing the symptoms that I mentioned and you stay long, the cancer will spread. You will lose your uterus. All right, we'll do a hysterectomy because the cancer has advanced, it has spread and now moved to your lungs and other parts. We'll do a hysterectomy. Once we do a hysterectomy, we may also put you on chemo and also sometimes even radiation. And all this comes with their own side effect. Radiation therapy comes with complications, okay? Chemo comes with complications. But sometimes, because you didn't report early, that becomes the only option for management, all right? Somebody is saying that he lost his in 2021. So sorry about that, right? So sorry about that. So guys, this is the end of part 1. This is the end of part 1. This is the end of part 1. We are now going to go to part 2. Are you ready? Let me know, how has this part 1 been? How has it been? Are you learning? Is it informative? Is it understandable? Have you understood all that I talk about cervical cancer? Talk to me in the comment section. You, sir, I see you. And guys, remember, if you hear all this and you don't practice it, it means all my talk is useless. You understand? You see all the symptoms that I mentioned. And just when we are doing this, people have gone to report the page again that I am giving people wrong information. TikTok people, my lovely friends, my doctors, my colleagues, please, let's support each other on TikTok. Let's support each other. When we see people doing something for the community, let's rather rally behind them. God bless you. God bless you. And the name is Dr. Felix Mawuko. Dr. Felix Mawuko. Dr. Felix Mawuko. I am a specialist medical doctor, and this is all that I do for you on TikTok. You want a platform where you get information in simple language, okay? This is the place to be. And I need all of you to be coming here. Trust me. The information I tell you guys here, it saves life. And we have saved a lot of people's life through this platform. My DMs, the testimonies that people send me, it's amazing. And that is what keeps me going. Even when people are trying to bring us down, God is also fighting for us because He knows the heart with which I am on this platform. So please keep coming and learn. I give you the best among the best as a specialist. God bless you. Are you guys ready for the stomach ulcer? Or you want me to do stomach ulcer? Should we do question and answers and we do stomach ulcer tomorrow? Let me know. I am your servant. So whatever you say is what I do. Do you want me to do the stomach ulcer today, or I leave it and we do question and answers? Brown skin, I see you. Talk to me. 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 Should we do question and answers today, now, and then we do the stomach ulcer tomorrow? Talk to me tomorrow. Okay, that means that most of you want me to do the question and answer section, so that is okay. Now, the good thing about my question and answer section is this: I don't limit it to only the topic that I've discussed. It is open, and trust me, by God's grace, any medical question that you have, we are here, and by His grace, we'll be able to guide you and give you top-notch information on that. We are trusting God, and I know what I'm saying, all right? He has blessed my head, and we don't want to go one day without blessing humanity with what He has given to me. That is what brought me on TikTok. So any medical question, it is free. You don't have to pay me. You don't have to be a gifter to come in my box. However, before you can come in my box, you have to give me a follow. It is the list that I ask of you. Click on my profile picture if you have a question, and even if you don't have a question, click on my profile picture, give me a follow. Also go to the viewers eye, Mrs. William and all those people. They are amazing people. My moderators are all there. Please go and connect with them. 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 So it's time for question and answers, because most of you say that I should do the stomach ulcer tomorrow. So I listen to you, my lovely family. What you say is what I do. Brown skin, welcome in. I see you, my friend. God bless you. Thank you. So it's time for question and answers. If you have a question that you want to ask, this is what you do. First rule, you have to make sure that you give me a follow. Okay? You give me a follow. Remember, tomorrow is going to be on stomach ulcer and then another thing. Okay? Another thing. I'll think about what to add to the stomach ulcer, and then we'll discuss it tomorrow. Thank you, brown skin. I see you. So today's session is now question and answer. Please don't go. My question and answer session is also another teaching session, because every question from every angle, medical question, we are going to answer it, and some of them will use it to teach you. All right? God bless you. Please send a request. This is how you send a request. You click on this pink and blue guest button, okay, and bring it up, okay. If you have a question, medically related question, medically related question, send me a request here. Click on the guest request and send a request. I'll bring you up, okay. And let's make friends. Okay, people have sent requests already. Let me start bringing them up. And please, before you send a request, make sure that you have given me a follow. I beg you.
Hello, Doc.
Yes, please, go ahead. Welcome to our platform.
Thank you, Doc Felix. Thanks for all you do. We really appreciate the knowledge. It's quite informative and we're learning a lot. Thank you so very much.
Just 1 minute. There is a question I saw earlier. I want to address it. Okay. Is genetic predisposition a risk factor for cervical cancer? There are... Guys, sorry. We have two main types of cervical cancer, okay? Squamous cell... Let me take some water. We have squamous cell carcinoma and then adenocarcinomas. Now, according to literature, both of them, they are not connected with genetics. Okay, so we cannot say that cervical cancer runs in family. Once your family member has a cervical cancer, it means that the subsequent family people have a higher risk of getting it. Okay, cervical cancer is one of the things that runs in family, like breast cancer and all the others. Cervical cancer, it doesn't necessarily run in family, so it's not genetically predisposition. Okay, so that is an answer to that question. So Abdullah, I think you were speaking, right?
Yes, I was.
Please go ahead.
Okay, I wanted to ask them. There's a close friend that kept complaining. A lady, she usually have this pain below her tummy region, you know, and occasional there's this hard spots. You know, she has once done a CS before, but we don't know and we can't tell if it's from there. But so most times there's this pain below, just below near her BJ under her tummy, and there will be some hard spots there, and then it comes up occasionally, and there's this pain there always, and this is constant migraine and all of that. So like, okay, what could probably be the cause to that dog?
All right. First of all, has the person gone to hospital?
Oh, not yet. Since the pain has just been lingering, and then it fluctuates on that.
I get it. Guys, when I bring you in the box, please do me the favor and kindly mute yourself for me. Remember, today is supposed to be on 2 sections, but you guys said that you want me to do question and answers for you. So I've curtailed it, but tomorrow we'll do stomach ulcers tomorrow with maybe something else tomorrow. God bless you, right? Yes, so first things first, like I mentioned, pain is a symptom, okay? Anytime you are getting pain, it's a symptom. Many things can cause the pain. Guys, please don't send another guest request. If not, we'll get jammed. We have already 10 people who have sent requests, apart from the people on the screen. Let me try and serve those people who have sent the request. Okay, there's still 10 people who are waiting in the queue. Please don't send more requests. If not, we'll get jammed and will not be able to talk to each other. I beg you, please stay with me and learn. When I finish the list, I'll bring another set up, okay? God bless you. Now, the first thing you have to do if you're having pain is to ask yourself, why am I getting pain? In the case of CS, incisional side pain, there are a lot of things that can cause what we call the incisional side pain, like you have described. One of them is the stitch. Sometimes, the stitch that they use, okay, sometimes we use absorbable stitches. Some people also don't use it. Sometimes some of the stitches can get buried in a soft tissue, and if it's not absorbable stitch, then it can create problems. Some of them can even form wells and they begin to heal. Another reason why you can get incisional side pain from post-CS is this. Sometimes some women get surgical site infection after CS. The wound get infected. When you get a surgical site infection, okay, you develop a lot of inflammation from the surgical site. As the inflammation subsides and the wound tries to heal, you form a lot of what? Adhesions. Okay, some of these adhesions can become a site of pain for you. Also, apart from the adhesions that you get, you can also get fibrous tissues. Okay, fibrous tissues developing at the post-surgical site as time goes on. So all these things can be a problem. Aside that, there are other causes of pelvic pain. It could be that the pain is from the surgical site, but it could also be that it is actually deep inside the pelvic. If you have a PID, it can present as pelvic pain. Thank you so fine. God bless you. Juliet, I see you. God bless you. You have what? You have uterine fibroid. It can present as pelvic pain. Okay? You have ovarian cyst. It can present as pelvic pain. So my advice is this. Please let the person report to hospital and get further evaluation. I am always here. If you need more, you can join me probably tomorrow or whichever day you find me. But please, the best to know to do is to get evaluated. Sometimes they can even examine where they cut to see if they are bones or maybe some berry stitch or something, and they can get them out and the problem is solved. And people like that, they have to do a pelvic ultrasound scan to look at the uterus, the ovaries, and all that to see if there is even any ongoing infection anywhere which may present like fluid in the porch of Douglas. Even sometimes ectopic pregnancy can present as pelvic pain depending on the sexual history, right? So that is what I want to say. Thank you so much. I hope this makes sense to you though.
Thank you so very much. I really appreciate it. I'll pass your message across. So this is quite informative. Thank you, Doc. We really, really appreciate it. God bless you for all you do. Thank you.
Thank you. God bless you. Hope you keep coming back, right?
Definitely. I have
God
a
bless you.
great follower, and definitely I'll.
Oh, thank you so much. Who is next? Alvin Walker. Alvarin Walker. How are you?
Good evening, Doc. I'm good, and you?
I'm doing great. How are you too?
Well, I'm giving God thanks.
Please go ahead with your submission.
Well, my problem is, I'm a bit worried. Actually, I done a pap smear, and I went to the gyno, and he told me that he saw something on my womb can be cancerous. I don't know what can really cause that.
Okay. When can you be clearer? He saw something where?
On the head of my womb.
On the head of your womb. Okay. That's something. Was he able to tell you what it is really?
He just told me that it can be cancerous, and they will have to remove it, scrape it.
Yeah, actually, for all women, your cervix is supposed to have this smooth appearance. Okay, the cervix when you go inside the VJ, when you pass the speculum and you open the place, that jaw, and it opens and you look at it, it's normally smooth, right? If at any point in time your cervix has anything there, that is a suspicious lesion. And sometimes the common lesion in that area is a cervical cancer. So sometimes some doctors will not take chances. But the good thing is that if they are thinking about cancer, it means that they have to do it quickly. Okay? There are procedures that can be done and they have to do it as soon as possible. So you have to follow up on your doctor and then order, because if it's even a pre-cancerous cell and they leave it, it is going to transform into a fully blown cancer, which we don't want it to happen. So if they have any suspicious lesion, there are different treatment, thermal treatment, cryotherapy, and then the surgery and excision and all those things come inside. So I would like to plead with you that you should be worried and put pressure on the doctor so that whatever intervention they think is appropriate for you, they give you that intervention as soon as possible. Okay?
Well, what they said that they I should be going to the hospital this coming Thursday for it to script.
Okay, that is okay.
Which I'm not gonna get a cut.
Okay, we don't just take you to search for the surgical room. Even if they have to do excision, there are other investigations or workup that needs to be done. So it's not like when you go on on Thursday, they are going to take you to theater or something. They first have to prepare you, and it's a lot of things. So it's not like the same day you go and then they have to go and do surgery. They have to do other blood workup to make sure that you are fit for surgery and you are declared fit for surgery. From there, then you can go for the surgery. But what I want to tell you is that even if it's a precancerous lesion, time is of essence, because even if you keep waiting, the longer you wait, if it's cancer, it means that you are racing against time and you'll be running out of time for your own good. Okay? Can you hear me?
Yes, Doc, I do understand.
Yeah.
So yes, Doc,
please,
I'm hearing you.
Yes, work hand in hand with the doctor as soon as possible so that the right decision in terms of intervention is made quickly, and then they do it quickly for you for your own good. And don't be dragging your foot. That is a mistake some of you do when it comes to cervical cancer. You have stage 1 cancer, they tell you we want to do something for you. You are like, doctor, unless you are giving, by the time you go back the next stage, it has gone to stage something and prognosis become poor. Cancer, remember, you are fighting or running against time. Okay? All right, thank you so much. Nice having you around. Okay, thank you so much. Sherry Clark, how are you?
Hi, doctor. I am doing
Hi.
fine. I am watching you from Antigua. However, I have a two question for you. When you do a pap smear test, when you do a pap smear test, it is the same as the HPV.
No, HPV stands for human papilloma virus. Okay, the pap smear can be used to diagnose HPV, the virus. So we do it to see if you've been exposed to HPV and if the HPV is around your place and all that, right? So the pap smear, we use it as a screening tool. We screen you for cervical cancer, but at the same time also it can be used to help especially the women, okay, to pick up human papilloma virus, which causes majority of the cervical cancers.
Okay, because I did that test recently, the HPV, and then I went to my gyno to do the pap smear in March because I did it last year March, so I said I would do it back this year. But she told me that I don't have to do it because I just did HPV.
You just did what?
She said I don't have to do a pap smear because I just do a HPV. So they didn't do it to me.
Okay, now that one, I have an issue with it. Okay, if you are diagnosed with HPV, okay, if you've done the HPV test, either in vitro or through other ones, okay, what happens is this. It actually means that you are at a higher risk of getting this problem. And therefore, if you're a woman and you've been diagnosed with HPV, because the HPV causes majority of the cervical cancers, you are actually a candidate that they need to monitor. You should be going for the pap smear from time to time. If somebody tells you that you've been diagnosed with HPV, and because of that, you don't need a pap smear, they don't marry well. They don't really marry well. Because the thing is this, the HPV, when you get it, sometimes it can stay with you up to even 10 years. Most of them, if your immune system is good, it will clear it by 2 years. But if your immune system fails, and depending on the type of HPV that you have, okay, you can end up living with this virus for over 10 years or even sometimes 20 years, right? Currently, there are strips that can be used to do the in vitro diagnosis and all that. But the most recommended one is through the pap smear, the routine pap smearing that they do for you. So for somebody to say that you have been diagnosed with HPV, when the person doesn't know when actually you got infected with HPV, because there is no test to tell us that, I think that you are a candidate who should rather from time to time be going for pap smearing to look at your cervix, whether there is any transformation going or precancerous cells or whichever. So if I am with you, that is what I will do for you. So what you can also do is that I tell you people that if you go to one doctor and you are not comfortable with what he has told you, please get a redress at a different facility. Right? Get a redress, because personally, I wouldn't tell my patient that you have HPV and because of that you don't need pap smear. Because the pap smear is something.
They are saying it actually is the same thing where they.
Oh, sorry. Please bring it up. Bring it up. Come back again. If they tell you they've diagnosed you with HPV test or whichever, and because of that you don't need pap smear, please don't accept that. Don't accept that. You can have pap smear done. You can have HPV, but it does not mean you have cervical cancer. You can have, you may not have HPV, but you can still end up with cervical cancer. So because of this, we are saying that the routine pap smear, okay, is independent of your HPV status. Okay? It's independent of it. Because like I mentioned, there are other things that can cause the cervical cancer. So if you have HPV, the fact that you've tested HPV in the past, that is actually a strong reason why you should be screened for cervical cancer. I hope you got that clear. Thank you so much. Just breath. How are you?
I'm good, thank you.
Guys, let me make this clear to you. We are saying that up to about 95% of cervical cancer cases are caused by HPV virus. And the common variant that causes the HPV are type 16, 18, and then some few others, okay? But the 16 and 18 causes majority of the cervical cancers, okay? It's like I have a car. Before the car will move, I need a fuel. And the fuel here is like our human papilloma virus. So if you're a woman and you've been diagnosed with HPV, it becomes a strong reason why you in particular, you should even become a regular candidate for pap smear. Pap. It's not pops. It's not pops. It's pap. The word is Papa Nicolau. Papa Nicolau smear, but people find it difficult pronouncing it, so they just say pap smear. But the full word is Papa Nicolau smear. Okay? It's named after the guy who first brought it up. So that is it. God bless you. Just breath. Please go ahead.
Thank you so much, Doctor. I just have a question for you, maybe an advice that I'm just seeking from you. So I have my aunt, and my aunt was diagnosed with cervical cancer, and also she has got full-blown AIDS. So now the cervical cancer is actually in stage 3. So they say they cannot remove the womb. They cannot do that. So they said the only option is it's either they should do a radiation or they should do the chemo. Yeah.
Yes.
So now with some other people, what they are saying is probably if they do the chemo or the radiation, it can actually intensify. Maybe the radiation, it can even make it worse. Like somebody can lose their life along that process. Or also some will say, or they are saying, if they do the chemo, maybe she can also lose her life along that. So we kind of like in between. We don't even know what might be the advice or what exactly might be the best in this scenario.
That is good. Like I mentioned, cervical cancer. Please, guys, stay muted. If you're in the box, please mute yourself. I beg you. If not, I'll drop you. Please, if you are in the box, kindly mute yourself, please. Mute yourself, kindly. Mute yourself. If you are in the box, mute yourself until I mention your name, that the mic is yours, then you talk to us. Thank you so much. All right. So, listen to me now. Like I mentioned, the treatment of cervical cancer varies depending on the stage and other factors, right? But mainly it's dependent on the stage of the disease, which is how far it has spread. Now, radiation, chemo, all those things, we mentioned it that they are modalities. Radiation therapy, just like chemo, what radiation therapy means is that, for example, if you have a cancer cell here, okay, for example, this particular one, we are going to focus a beam of radiation and target that particular area. Listen to this very carefully. That is what radiation therapy means, right? But because we are not God, okay? Because the person doing the radiation is not God, and the beam that we use, the goal is to destroy the cancer cells. But because you have increased the radiation, the X-rays or whichever beam we are using, it will end up also affecting normal body tissues in that area, right? Radiation also has its own side effect. It can create other problems. However, I will tell you that the benefit in terms of the cancer that the person is having vis-a-vis the risk that will come in future, the benefit far outweigh the disadvantages. Right? So it's one of the normally acceptable ways of treating cervical cancer based on the stages. Right? But of course, it comes with complications. Sometimes the skin, even some people, the skin can have some issues and all that. But over time, what happens is that you can get things back. I must say this also because I don't want to give you half-cooked information. There are some people, when they receive radiation therapy, not for cervical cancer necessarily, it can also put you at risk of other cancers in future. As a specialist, I don't want to just give you the sweet part. That is it. Radiation on its own, even when you receive it for a particular cancer, okay? Some people, not everybody, in some few majority of them, it put them at risk of other cancers in future. It's not because the radiation oncologist or whoever did this thing is not good at it, but it just tells you that we are not God, because the radiation, the beam that is being put there, it has the capacity to destroy the normal cells and also the cancerous cells. And if the normal cells are destroyed, the genetic information, the DNA, the normal information that they carry, they can also be altered. And because of that, they can change and now begin to grow. So it's also a possibility. But when it comes to cervical cancer, I will tell you anytime that if after further evaluation, thorough evaluation, they tell you that radiation therapy will be helpful, the person should go for it. Anytime you delay with cancer treatment, you reduce your lifespan by a percentage. Remember that statement, everybody. God bless you. Just breath. Are we together?
Yes, I'm hearing. So what about chemotherapy, sir?
Yes. Chemotherapy also comes with issues. The chemotherapy means that we are going to give you medications that we don't normally give to everybody. They are cancer specific sometimes, and unfortunately for chemo also, when you take chemo, okay, guys, sorry, I have to be very honest. We are here to learn, and as a specialist, I don't want to just give you the sweet part. Chemo works very well, but even paracetamol that you take, it has side effect. Now, when it comes to chemotherapy, this is the thing. Their goal is to target the cancer cells, but unfortunately, when you take those drugs, they also affect other normal cells. Okay? Anemia could come in. Along the way, collagen can be destroyed and other things. You start having skin problem. Okay? The hair will start falling off. All of them are also side effects of chemo. But in the long run, if you're able to go through it and your cancer is chemosensitive, you come out laughing and you can get your hair back and you can get your skin back. So it also has side effect because the medication are very, very strong medications that when they are in your system, it's like you are fighting a war against a country that has all the military ammunition and you are just having some one pistol. You want to hit it from all angles, and that is how chemo medications work. So it also has side effect. But sometimes we can be changing the drugs to put the person on which one has a lesser side effect. But no chemo goes scot-free. You get some side effect out of it. It is something that is well documented.
Okay, thank you so much, doctor, and God bless you.
But tell your sister that any time that she delays, her life is also being reduced. Okay?
Thank you so much.
Very
Yes.
important statement. Go and say this, that I said that if you are they propose a cancer treatment and you are dilly-dallying, drawing your feet, any seconds that goes, that is your life that you are reducing. So you should make the decision and agree as soon as possible. Okay?
Okay, so thank you so much. Thank you so much, sir.
All right. Janet Tabifi or something. Please, the mic is yours. Go ahead.
Yes, Janita. All right, thank you. So a question here. How is it that having fibroids can increase your chance of cancer, cervical cancer, or anything like that? If you have multiple fibroids?
Okay, good question. Fibroid are non-cancerous growth that occurs within the muscle layer of the uterus. They don't have any relationship with cervical cancer. Simple and short. Having fibroid does not mean you have cancer, and having fibroid does not increase your risk of cervical cancer. No.
Okay, another question also, what would be your advice to someone who hasn't had children yet, but they have fibroids and it's that bad that you have like one implanted in the wall of the uterus and it's causing very like severe bleeding to the point where the person is anemic rather, and like feel faintish and all of that on the second day of her menstrual every month, and to the point where the person blood count went down to 5. What would be your I don't know, advice? Do you go on the pill? Do you take tablets to stop the period? Would you do the surgery to remove that fibroid, even though it's in the walls and may cause I don't know. So I'm throwing that out to you.
Okay, just stay on the screen. I want to change my background to your question so that when I'm explaining, somebody can understand it, okay? All right, so this is a uterus, okay? And then I've been discussing fibroid. Have you joined my live stream on fibroid before?
Yes, I think I came on once and you were talking about it, but I was late.
Okay, so when it comes to the management of fibroid, these are fibroid, like I said, they are non-malignant growth within the muscular wall of the uterus. Now, when it comes to fibroid, okay, and the treatment, there are multiple factors that we put together before we make the treatment. One of them is the location or the type of fibroid. This fibroid outside here, this is known as a subserosal fibroid because it's just under the first outer layer or the outer layer known as the serosal membrane. So it's known as subserosal. Now, when the fibroid nodule grows within the middle layer or the muscular layer, because it's within the muscle, it's intramural. Mural from muscles, and intra means within. So we call this one intramural fibroids. Typically, this type of fibroid, the first one that I talk about, because they are outside but under the first layer of outer covering, they don't affect your fertility. So if you have this type of fibroid, okay, and it's very small, okay, no doctor will be in a rush to go and take it out for you. Now, then we have this type where it is within, very deep inside the muscle layer. If it is very small, that one to no doctor will disturb you, okay? And if your menses is not affected, no doctor will disturb you. Now, let's proceed. This is a third type of fibroid, this one here, known as submucosa. Remember, this one is subserosal. From the serosal membrane is under it, so subserosal. This one is submucosa. It's just underneath the inner layer, the mucosal lining of the uterus, so we call it submucosa. This type of fibroid, they cause a lot of problem. They can cause, in fact, miscarriages, a lot of bleeding, okay, in clots, and they put you at risk of anemia. Remember, chronic severe anemia that is not corrected can also lead to other complications, which I don't want to go there for now because it's not about fibroid that we are discussing. So the point is this: if you have a fibroid and it's making you bleed excessively, okay, that becomes an issue. Medications are not working for you, then that thing has to be taken out. If you have a fibroid that is so big, okay, it is so big that it has distorted over 50% of the uterus, okay, more than 45 or 40% of the uterus, that becomes an indication that that nodule has to be removed, either through a myomectomy or whichever. Then the next important factor that we consider whether to do treatment, the treatment is your age. If you are old, it means that you are not going to give birth again. So in that case, if the fibroid is giving you troubles, then the doctor will just tell you that, you know what, you don't need your uterus for anything. Let's just bring out everything out so that we save the whole situation. So once you are not going to give birth, then we are going to do a hysterectomy. Now, if you want to give birth, like in your case, and you have a multiple fibroid, and this fibroid is making you to bleed to the point that it is making you anemic all the time. Especially, the troublesome one needs to be dealt with. You understand? HB of 5 for an adult, that is very terrible. And it can cause problem for you. It can cause heart problem. It can cause heart failure. Your heart can fail. If you're an adult, you are not a sickle cell patient, and your HB is consistently every month or every 2 months, you have HB of 5 grams per deciliter. That is severe anemia. It can cause other cardiac problem. Because of that, I would like to advise that if you want to give birth, then it means that your uterus cannot be taken out. But if the fibroid is causing problem, causing you to bleed, not responding to medication, they have to try and take out the uterine fibroid. Sometimes it's a very difficult surgery. You go inside there and you are not able to, you find it difficult to repair the uterus. But in your case, the uterus has to be repaired because you don't have kids, you want children. So myomectomy has become an option. If not, it can create problem for you in future. Remember, the longer you keep it, the more miscarriages you can be getting, and the more problematic your menses will also become. Okay? But also, I have to say this: fibroid surgery can increase your chances of getting pregnant. But in some people also, it can worsen their chances of getting pregnant. Why? When you have multiple fibroid and we go inside to go and fish them out, okay, do a myomectomy, what happens is that it means you have created more scars. You create more scars. And especially if it's a submucosal fibroid, then it becomes a problem. The other option that we can use is that we can also go inside here like this, okay? A hysteroscope, and then depending on the location, we try and get it out. But that does not work for every woman because of the location and the different type. So that is it. If you want to have a baby, you have a child and all that, then it becomes very tricky. But all in all, anemia is going to disturb you if you live with them for a long time. And I don't think you want that for yourself.
Yes, thank you so much. Just one question before you go, though.
No.
If I'm not quite ready to remove it yet,
calm down.
based on...
Calm down. I have rules here. Each live session, you can only ask 2 questions maximum for the sake of your other friends.
Okay.
I beg you. Tomorrow, God willing, I'll be here
Thank
again.
you so much.
And every live session, you can ask any medical question. You can come back tomorrow and we'll continue with this fibroid. But for today, I have rules, 2 questions per each person because the queue is long. Okay? I still have 9 people in the queue.
Understood.
On the screen. But
thank you so much.
What have I explained? Have you understood? Does it make sense to you?
Yes, I understand what you're saying. It's just that I can't do the surgery now, so I was wondering if the birth control would be enough to probably just take it and just don't have the period for this month or next couple of months to give me my body a break.
they only go in, some of them reduce the pain, some of them will block the production of estrogen, right? Because the fibroid nodules, they feed on estrogen as a fuel. So that is why it is common in people who are in their reproductive years. Okay, some of them will just block the gonadotropic hormones, they will just block the production of estrogen. It will make the fibroid to shrink if you block estrogen. However, it will not take away the fibroid.
Okay.
You get it?
Yes. Thank you so much.
Thank you so much.
Thank you.
All right. Beautiful. How are you?
I'm fine. Thank you so very much, Dr.
Thank you so much for the gift, sir. I appreciate all of you, the roses, everything. Thank you so much. Yeah, go ahead, beautiful.
That's okay. This is I really like the teaching, and just to add and to say that you are not fake. You're teaching us the right thing. What you the other users just left. I had that same type of fibro whereby I was bleeding with clots and I was also anemic. It came to a stage that I lose a lot of blood that I could not. That means mine was even an emergency. They had to go and take the multiple fibroids out because I was thinking that because the doctor told me my own case was in a situation whereby if I'm locked, I will still have more children. I have one. If I'm not locked, I will not have. Up to today, I don't even have. I only have one son. It was done in 2016, and I'm maybe 45 now. So I just want to add that what you are teaching us is genuine. You are not misleading us. So I'm just confirming those who are reporting you, so that at least this video is recorded, so that if TikTok listen to it, we know that okay, that means you are teaching us rightly, and they will not block your account. So I just came to just add that. Okay, doctor, what I wanted to find out is. Let's say, like as I told you, my age. I lastly did perhaps 5 years ago, and since I am not doing such thing, right, and I don't have a partner, is it advisable for me to be still doing the PAPS every year?
Okay, good question. Good question. And did you guys hear what I said? Because I'm not doing that thing. See that, my friend, my sister, and everybody here, listen to me, please. Ask me, like I said, please, beautiful, kindly mute yourself for us. And thank you for those your kind words. You see, I just said something, and he has been in that situation, okay, where I was telling the other guy that doing the myomectomy can worsen your pregnant fertility or can make it better for some. So, I like I told you guys, I am a specialist. And I'm not just a specialist. I'm a specialist that God has blessed so much. And that is why I'm here on TikTok. So the last thing I want to do is to come here and put my life on the line for the whole world. No. People who are reporting me, they are just reporting because of, the jealousy and all those other things. But we keep it moving. All right? God bless you. So, beautiful. The thing is this. Like I said, beautiful, unmute yourself and answer me. When are you supposed to stop doing pap smear?
65 years.
Exactly. I'm happy that one has stuck there. Whether you are doing ta or not, the pap smear, the word is not pap smear. Routine. When we say something is routine, you understand? It becomes part of you. That is why we don't say go and do. We say routine pap smear. It becomes part of you. So whether you are doing give it to me or whatever, whether you have intimate, you are sexually active or not, the thing is this, the virus that causes the cervical cancer, okay, you could have gotten it 10, 20 years ago. Listen carefully. You could have gotten it 10, 20 years ago. And because of that, and probably your body couldn't handle it, and it's still inside, this HPV can stay inside you for 20 years without any signs and symptoms if your body fails to clear it. But that time you did 20 years ago. Probably you didn't get the virus even through or anything. Maybe it was skin to skin contact. Your body couldn't clear it. The virus goes into hiding. The next time you see it will be maybe after 10 years, 20 years. And when it comes back, it is not coming like the virus. It is coming as a complication. Cervical cancer, vulvar cancer, vaginal cancer, VJ cancer, anal cancer, oral cancers, throat cancers, cancer of the bula in men. Okay? So because of that, you can't say that as a woman because you are not sexually active, you are not supposed to be doing pap smear. If you're in a country where it's yearly, you have to be doing it. If it's 2 years, you have to be doing it. If it's every 5, you must be doing it. So that is my answer. If that is what you are doing the wrong thing. From today, please resume back to your routine pap smear. The word is routine. It is unconditional. Okay? I hope with that I've answered your question.
Thank you so much. Just one last, I know it's not related, but I just need your advice. I just entered into my menopause and I have this heat. And I took this medication by my doctor, and he said I must take it only for 3 months. I think it's estrofam.
Don't mention names, please. No.
Okay.
You don't do names of medication here, unless they are just over-the-counter medications, please.
Okay, sorry. Okay, I just wanted to find out whether can I still continue taking others, or maybe if I take it, I can get some complications because I still feel some more heat.
Yes. So you have to understand something. One, it is unprofessional for a doctor. Please stay muted when I'm answering you. Okay.
Okay.
It is unprofessional for me to be here. I've not examined you. I've not evaluated you. And then I go ahead, I've not seen your full history. And then I go ahead and tell you that stop taking a prescribed medication. However, this is my advice for you. If you are on any medication and for whatever reason, you are not seeing the effects or you are getting other side effect that wasn't there before the medication, the best thing to do is to report back to the doctor for reassessment, right? Reassessment. Burning sensation in menopause is common. However, there are other things that can cause burning sensation. Have you been evaluated for that? For example, if you are somebody who is having B deficiencies, okay, B12 and all that, they can give you burning sensation, okay? Neuropathies can come from that. If you are somebody who have been getting back pain, you can be getting burning sensation in your foot, right? So all those things has to be evaluated. It's not just about menopause and therefore you leave everything to menopause. You can be diabetic. If you are diabetic and it's undiagnosed or unmanaged, you can end up with burning sensation in your legs. Have you been evaluated for that? As for the medication, I can't say continue or don't stop or stop because I don't have your full history. But all these things that I've mentioned, if you're having burning sensation on your foot, do you have back pain? Have you been getting low back pain? If yes, have you been evaluated for that? Do you know your blood sugar? How often do you check your blood pressure? All of them can cause that symptom. If you evaluate them and they are not there, then you can now leave it to menopausal symptoms. Are we together? All right.
Thank you so much.
Oh, sorry, I muted you again. Sorry. Are we together, please?
Thank you so much, doctor. I think it's coming from the back pain because you have this back.
See your life.
My work, I sit a lot, so
you see your life.
Back pain is a problem. Thank you.
See your life. You see your life. So get evaluated for your back pain as well before you leave everything that it is menopause. And check your blood sugar also. Okay?
Yeah, I will check it. I have the machines at home. Yeah, thank you so much.
Welcome. Have a lovely night. Bye.
You too. Bye.
Clara Sam, the mic is yours. Go ahead and talk to us. I have 9 more minutes. Clara Sam, we've been here for how long? I've been here for 2 hours, 43 minutes. Almost 50,000 people have passed through the live stream in this less than 3 hours. Yes, go ahead. Clara Sam, go ahead, please.
Yeah, thank you so much, Doctor. Thank you for all you do. Can you hear me?
Yes, please go ahead. We can hear you. Thank you for appreciating us also. We appreciate your kindness. Go ahead,
Thank you
please.
so much. For over 2 months now, I noticed that my voice changed. So I used to have like a crack in my throat. My voice changed. So I don't know what is the cause. I've taken some medication. I've taken like ginger water, bitter cola to know if it will clear the throat.
Hey, you alone. Go ahead. I'm just pulling your legs.
So up to now, it's still there. I can't talk like the way I talked before. So I don't know what might be the cause.
Okay, my first question. Have you reported this to the hospital before I continue?
No.
Okay, so you've committed a first-degree crime. Okay, when something is changing, something is going on in your body, the first thing you have to do is that report to the hospital. Like you've come to Dr. Felix and you are talking to me. Talk to the doctor. Doctor, I've noticed this ABCD is changing in my body. Then they run tests. So you are going to do that for me, but I'm still going to guide you, give you some advice. There are a lot of things that can cause change in your voice. Okay, change in your voice. One, if you have PCOS and your body start making a lot of androgens, okay, your voice can change from the normal light one to become deep and all that. Thyroid problems. If you have a thyroid issue, okay, that can also affect your voice. So that one also is one thing. Now, in some people, when they put on a lot of weight, okay, it also affects their vocal cords, so they can have issues with that. Because of that, that is why I asked you the first question. Have you reported this to the hospital? And there are other medical conditions that can also actually affect your vocal cord and also your throat and all that. Please, since I've not seen you, I've not examined you, I've not seen your full history, I humbly... Oh, my light is out. Don't have light. Now I was just using the bulb, so now we have an issue. Just hold on. Let me put on my other phone. I think it can help us a bit. My time is even almost up, so just hold on, guys.
Okay.
Now this is phone light.
Okay.
Oh, lights are back. The light is back. The light is back. Okay, so let's continue.
Yeah.
Light is back. All right. I don't use ring light. I just have a bulb on top of me, and that is what I use. Welcome. All right. So because of that, please, Clara Sam, this could be a serious problem going on. You could even have I don't want to mention some other thing. I don't want to scare you. Sometimes when some things are growing inside your throat, all of them can affect your voice. So you need to be evaluated. Kindly stop delaying. Stop wasting time. If it's a serious problem, the longer you wait, the severe it becomes. So please report to the hospital so that they can fully evaluate you. Your thyroid needs to be done and all those things that I mentioned. Even sometimes your ovary has to be looked at. Okay? PCOS can cause your voice to begin to change. And other things. So that is my advice for you. Okay?
Okay. Thank you so much. Bye. Thank you.
Okay. It's a bad word. Something. It's a bad girl. 21. How are you? Welcome to your platform. It's a bad girl. 21. Hi.
Hello. Good evening.
Good evening. Your network is not good.
Hi.
Hi. Go ahead. We can hear you. Welcome to our platform.
I'm not too bad, you know. Me just ask if when you get cervical cancer, if you can get pregnant in the process.
If you get what? Me don't understand patois, Jamaican patois, so try and speak slowly. Me don't understand Jamaican patois. You know what I'm saying? So speak slowly so that I can understand you. All right? Go ahead again.
Me just ask if when I have cervical cancer, if you can get pregnant in the process.
Oh, okay. If you have cervical cancer, can you still get pregnant in the process? Is that the question?
Yeah.
Yeah. Yes. It's a yes and it's a no. Let me take the yes part first. If you get a cervical cancer, you can get pregnant, all right. But that becomes what is known as a high-risk pregnancy. How can you get pregnant? If you get a cancer and it's still early and the cervix is not blocked, then what it means is that when your man put the semen inside there, the sperm cell can still pass through and then go inside, swim all the way into the fallopian tube and go and fertilize the egg, right? So that is how you can get pregnant with cervical cancer, depending on the state. But that pregnancy is still a high-risk pregnancy. Why? There can be complications, okay? Whilst the pregnancy is going on. Sometimes you now have to choose between the pregnancy and the baby. The baby growing inside you and the cancer, right? So take note of that. Now, the no part is this. If the cancer has advanced, it has progressed, and the other part is also now involved, and they block the cervical opening, the os of the cervix. What it means is that even when you are laying egg or ovulating, when your man put the semen inside here, the door has been closed. And as long as the door has been closed by the cancer, it means that the sperm cells will not be able to get access into the uterus and get access into the tube to go and fertilize the egg inside the tube. Because of that, it's a no in that situation. So it's a yes and it's a no, depending on the morphology or the stage of the cancer and whether it has blocked the cervix or the cervix is still open. But remember that even if you get pregnant in the presence of cervical cancer, it becomes a very high-risk pregnancy. That is what I would like to tell you. Okay. So it's a yes and no. Have you understood the explanation I've given you?
Yes, sir.
All right, so that is it. All right? Thank you. Yes.
So if you want to get suppose I want to get it in the process, it still can then can place it inside, don't?
You guys, I need a part one. I need a Jamaican person to come in. So fine, where are you? So fine. Me don't understand your part one language. You talk slow. When you talk slowly, I can understand you. Huh? Yes, I can see you're Jamaican, right?
Yeah.
I know so far. I know you are from Trinidad.
Yes.
Your network is
May I say, if you need one, if then can place it inside.
Okay. If you need one, can they place it inside? Is that what you are saying?
Yeah.
Okay. Now, when you have cervical cancer, IVF also becomes a problem. Because in IVF, what happens? Either you are doing IVF or IUI, okay? IUI is intrauterine insemination. Okay, that one, they have to harvest the thing outside and then use a long tube and then pass through here, go inside, and then put it there. That is IUI. Then we have IVF, where they fertilize the egg and the semen outside, what we call it. So typically, let me go back again. In the IUI, what they are doing is that they are shortening the journey for the sperm cells. So they pick the sperm cells through a specialized test tube and then pass it through the cervix and go and inject it or implant it inside the uterus so that they can easily swim to your fallopian tube and cause fertilization. That is IUI. Now in IVF, they fertilize the egg and the sperm cell outside your uterus. When the division starts, the blastocysts and the cells are dividing. Let me just put it that way. When the cells divide up to some stage, they pick it together, the fertilized ovum and everything, and go and put it back inside your uterus. Okay, that is IVF. In the presence of cervical cancer, both of them are not easy. Okay, because you may want to go inside, okay, and then what will happen? You will break up the cancerous cells and you begin to bleed. And you know, when you are doing IVF in the presence of cervical cancer or IUI in the presence of cervical cancer, one thing we don't want about cancers is spreading them. And if you have to pass through here and you have cancerous cells here, what is likely to also happen is that some of these cells can be translocated into the uterus. You are further spreading it. So it's not an easy thing to do. It comes with a very big risk. It comes with a very, very, very big risk. So sometimes it gets to a point where you have to choose your life. Okay? You have to save your life first. Babies, you can get surrogacy if you have money and other things. But sometimes cancer, as I've mentioned, every time that you wait, every second, if you delay 1 second, you have reduced your life by 1 second. So always remember that guiding principle.
Okay, thank you.
You're welcome. Thank you so much for coming.
Okay.
All right. Star, how are you, Star? Star, how are you? You have no name. And Star, how are you? You sent a request.
Hello?
Yes, hi.
Okay. I know you're on the topic of cervical cancer, but I wanted was to ask you about the stomach ulcer because I'm experiencing some symptoms.
Dr. Moss, welcome in, bro. How are you? I see you, Dr. Moss. Good to see you. Guys, I'm sorry, and sometimes I have some of you, my good friends. You are all my friends, but some people are so close to me. When you come and I don't acknowledge you, don't think I'm ignoring some. Like I'm talking to you, everything I've discussed with you today, it's not like I have something in front of you talking from me. No, everything is here. So most of the time when I'm on the live stream, I don't focus so much on the comment section. So you can be a close friend, a friend, you come and I don't acknowledge you. Please forgive me. But once in a while, I see something in the comment section. So forgive me for that if I don't acknowledge your presence. Thank you so much. Please go ahead. The stomach cancer is going, ulcer, and then all the complications are going to be tomorrow. So if you don't mind, please, don't let us drink the soup around the food today. Let's cook the food so that tomorrow we put everything together.
Okay. I really want to talk to you on that topic, but I'll wait until tomorrow then.
Yes, please. Tomorrow we are going to, because it's something I'm going to do, I want you to listen. Sometime by the time you finish listening my discussion, your question might have been even answered along the way. Do you get it?
Okay.
Yes. So since tomorrow we are going to do the stomach ulcer tomorrow, please let's do it tomorrow. And if along the way I don't answer your question, then you can actually still come up. Okay?
Okay.
God bless you. Call me, Kemi. You've been here for a long time. Let me give you the option. All right, guys. So this is what I do on TikTok, and I'm here with my moderators. So fine for me. And I have my mom, Mrs. William. Every Sunday we'll be on Mrs. Williams' platform, and then we'll talk. Okay, I am a constant speaker on her platform once a month. Okay, I'm his son also. Please connect with Mrs. William. Go to her page. You see a link there for Sunday's upcoming events. Is going to be on how to escape abusive relationship, right? So take note of that. Go and register for that live event. I will be there myself, though I'm not a speaker, but you will find me there. And in the course of the month, we are going to do another topic on her platform, which I will be the guest speaker. That is this July. So please use this opportunity to connect with my mom for me. And as I tell you guys, when we come and our views are good, please make use of it. Be making friends among each other and share the live stream. Power tap. Supporting a platform is not only about gifts. Okay? We don't force people for gifts. If you love what we are doing and you willingly give us a rose, we appreciate it. Other than that, please keep inviting people. Let them come and learn. This is value for time that myself and my moderators, I give you. And every gift, any support you give us, I appreciate it. Thank you so much. Somebody is asking, is this live being recorded? Yes, TikTok records every live, but it lasts up to only 90 days. After that, you can't get access to it. And this reminds me, guys, on my bio, my TikTok, my YouTube link is there. My YouTube link is there. Guys, please help me. Kindly click on my profile picture if you have not given me a follow. Give me a follow. After that, go back there and go and subscribe to my YouTube so that when I edit this live stream, I've not started because I want to reach some number, okay? Once I hit 2,000 subscribers on YouTube, I'll start editing these videos, no announcement, and put it there. You go and watch at your own convenience, even when you come late, okay? God bless you. Call me Tenny. How are you?
I'm good, thanks. And you, doctor?
I'm doing well by His grace. Please go ahead.
I've got 2 questions. One, I was diagnosed with cervical cancer. I was diagnosed with cervical cancer in 2021. I had a hysterectomy, of which I've been experiencing the heat on my feet. And a few days ago, I started feeling like my boobs were like swollen. I can feel the pain when I touch them. So I don't know if it's something to get worried about.
Yes, because that is not a normal thing, and anything that deviates from the normal is an alarm for you to be worried, because it tells you that something is not right within your body, and your body is trying to respond by showing you a sign that I am not doing well, right? So, those of you who heard her, she said she did a hysterectomy. Is that what you said?
Yes.
Okay, hysterectomy simply means that they took out the uterus, right? And I would like to tell you that, please, you have to report back to this hospital, wherever they did the surgery or whichever. It may not necessarily, this feet swelling and other things you are talking about may not necessarily be related to the uterus that removed. It could be the onset of a new thing altogether. But if it's a new thing, then it means that the earlier you go, the better for you. So our advisor, like I told the other woman, there are many things that can cause all those things. If you have swollen foot, it could be that, I'm not saying you have, I say it could be because I don't have your history. So I'm just giving you differential. It could be that your heart is having a problem. It doesn't mean you have a heart problem. It could be. It could be that your kidney is not working well. It could be that your liver is up. Anything is possible, right? So the best thing to do to know why these things are happening is that you go to the hospital and they get evaluated you. Sometimes even in some women or some people, when you get a pelvic mass and it's compressing on something, your lymphatic system and all that, Okay, it can also cause swelling of your foot and all that, right? You have diabetes and all that, and eventually your heart or your liver is harmed, your kidney is harmed. It can cause all those things. So to know the actual cause, quickly report to the hospital. Let them do a proper history, physical examination, and lab investigation so that they can arrive at the diagnosis. That is my advice to you as a specialist. Are we together?
Yes, all right, thanks. And one more last thing. I know when someone have hysterectomy, they can no longer have kids.
Please, it's not hysterectomy. Please calm down. It's not hysterectomy. It's hysterectomy. HYS. Hysterectomy. It's not hysterectomy. You be confusing my. Continue. I know you are not a medic. I'm just making fun of you. Don't mind me, okay?
Okay, all right. Okay, if you did hysterectomy.
Yes, now you are doing better with the pronunciation.
You can no longer have kids because you don't have a uterus. That's biologically. But I heard some people being pregnant after that. Where would the fetus be if it happens that one is pregnant?
Okay, listen, you are having a misconception. We have two different procedures. One of them is tubal ligation. You are confusing tubal ligation with hysterectomy. Okay? Hysterectomy means that we have removed, please stay muted, please, kindly stay muted. Hysterectomy means that you have removed the whole, what do you call it? Uterus. Okay? You have removed the uterus. Without the uterus, and then the place is sealed off. It means that semen or sperm cells cannot travel beyond your vagina cavity or your VJ cavity. Because of that, it is almost near impossible to get pregnant after hysterectomy. Because when we take out the uterus, we don't leave the connection between your VJ and your pelvis. We seal it off. So everything is sealed down here. So it means that even when your man put the semen here, the semen cannot move up, right? However, when you do a bilateral and tubal ligation, some women, they go for the I don't want to get pregnant again. They go and we do a procedure known as BTL, right? BTL. Those ones, some of them, I have actually even seen one in a hostel where the woman came back with their husband. They were angry. The doctor has to now explain things to them. This is what happened in BTL. So in BTL, we just hold the tube, clamp it here, and then we cut, and then we tie it off. Okay, so we clamp, let's say this side like this, we clamp it, we pull it up and clamp it and like this. After that, we cut the top up, it will separate the tube, and then we tie them off, right? But in some women, for some reason, a few women, after BTL, it's been found that some women, their tube reconnected. So such women, they end up still getting a viable fallopian tube, and the semen goes inside it to go and fertilize them. But for a hysterectomy, where your uterus have been removed completely, the same person getting pregnant, unless the person has a congenital malformation. Some women have two uterus or true uteri. The uterus can be two in some women. The VJ can be two, the uterus can be two in some women. It does happen. So sometimes, in rare conditions, the uterus is two, only one was seen, the other was not picked up. But that is also very rare. So in nutshell, I think that you are mistaking BTL, where some people get pregnant after BTL, with hysterectomy, which is total removal of the uterus. Are we together?
Yes, I understand now.
Yes, so that is it. It is not hysterectomy. Most of them result from bilateral tubal ligation. Okay? Thank you for understanding. God bless you.
Thank you so much. Thank you.
Welcome. Bye.
Sure, bye.
All right, guys. My time for sleeping is up, and I don't joke with that. I need to sleep. Tomorrow is weekend, so tomorrow I'm likely to. I don't have anything to. No, tomorrow I have some students I have to go and teach. I'll be live in the evening. I was going to say that daytime, but no, I just remember I have something I need to do with some people. So because of that, I'll be live tomorrow again, God willing, in the evening between 7 and 8. But sometime my time, I'm not able to fix time and stick to it because sometimes I give you time, but something happened. You know the nature of what we do, and I have other things that with me myself also. So sometimes when I give you time, I may not be able to fulfill it. So the best thing I tell you is that give me a follow and turn on the notification, the bell that is there. After you've given me a follow, switch it on to all. In that case, anytime I come live, TikTok is going to send you a notification and you come and join me. God bless you. And also all these gifters, even somebody who has given me 1 rose, don't underestimate them. Connect with them. Connect with them. Connect with them. I've been here for 3 hours. We have 51,000 plus people who has passed through this live stream. If you've not made friends out of over 50,000 people, that is not good for you. Huh? That is not good. When you are here, make friends as well. Okay? God bless you. Power tappers, sharers, gifters, everybody. Don't think that because you didn't gift me or you are not a gifter, I don't appreciate you. Whatever you've done, you even choosing this platform to be one of your #1 destination to come and be learning. Despite all the attacks that I am still getting from people on this app, it means a lot to me. Thank you so much. And my apologies, there are still 7 or 8 people in the queue. I can't serve all of you one day. Navika, I didn't receive your request because there are other people there and my time to sleep is up. I beg you. Tomorrow, if God permits and Christ doesn't come, I'll be back again. Kochika, welcome in. I'll be back again. We'll talk about stomach ulcers tomorrow and probably something else. I'm not sure what I'll combine it with, but we'll discuss stomach ulcers. Remember, you can get stomach cancer out of stomach ulcer if you don't treat it well. And come and learn about why, how, and what you should do to prevent and manage and cure stomach ulcers tomorrow. I'll be here with you. My moderators, I appreciate all of you. Mrs. William, Denise, everybody here. God bless you. So fine for me. God bless you. I love you guys. Have a lovely day. And guys, I beg you, I need one person to come and pray with us and we call it a day. One volunteer willingly to come and pray with us. I've realized that anytime I come live and then people see that my views are going to trying to get back to what you used to get. If you guys notice, when I was having 1,300 views today, that was when I got a notification that I've been reported for giving bad information. But thank God, something, I don't know how it happened, but our views dropped, but it didn't drop so much. So we appreciate it. Anybody here who want to give me a prayer, give us a prayer and we call it a day. Please give me love emoji. Anybody, not among the team. I don't want Mrs. William. I don't want a moderator. I want a neutral person. I don't want my mom. Anybody, please, anyone here. Anyone here. Okay, Ashra has given me love emoji. That means she's ready. Thank you. Oh, Ashra, you can't go up. You can't come up. Ashra, just get some coins. Go to Kigani's platform, Tia Gold platform. Go and grow your account. Within 1 day, you hit 1,000 and then you can come. I want to come bring you up, but your account, guys, everybody. I can't even pin him. Oh my goodness. Please, guys, help me. Let's connect with this person. Please, connect with this account. Let's show her love. Her account is new. She has 2,244 people. Can we all connect with this account? Please, kindly, do that for me. Do that for me. I'm still waiting. Another person to come and pray. Ashra, you can't come up because of your... Okay, Zara has also shown me loves emoji. Connect with the pin account. Oh, what did I just do? I've removed Ashra. Please connect with this pin account for me. Connect with it. As I bring another person who has given me love emoji up. Oh, all the people are not able to come up. Okay, Zara. Let me see Zara. Okay, Zara can come up. Good. Zara Pretty, how are you? Hello, Zara Pretty.
I'm fine.
Please, can you give us a closing prayer? Any way that you want to pray. Any way. As the Spirit directs you. Pray with us. Because there are times I'm getting on this app just because I'm trying to help humanity. Sometimes it baffles me. I'm a human being and I must tell you this, guys. Sometimes it gets to me. Because I put in a lot of energy to do this for humanity. And I find it very, sometimes demotivating when I'm live stream and I'm getting notification that I've been reported for so and so, misinforming people. It really gets to me. But God is our strength. God bless you. Zara Pretty, please kindly give us a closing prayer. And thank you everybody for the shares, the likes, everything. God bless you. Hello, Zara.
Yeah, hello.
Yes.
The thing is, praise the Lord. Before starting this program, did you pray?
I always pray before I come live. So you just help us with the prayer. I don't come on live stream without prayer.
Alone you come alive, or with the people you like, the few people you pray with them, right?
I pray alone. I'm the host. So I don't have all the people that I have to call them. Everybody has a schedule. So it's not going to be possible that I have to call everybody that we pray before I come live.
You don't know why I'm saying it, and you don't even know why I'm asking. Sometimes we all learn. We are here to learn from you. You also, you are led to learn from us, Because the enemy never like good things, you understand? And a lot of people might have learned from me. I've been following you for like some months now, And glory be to God, I'm a mother also. But, when good things are coming, the enemy don't like it. What I'm asking is that sometimes when you come to life like this, and what you are teaching is a thing that every woman, especially women, would love to learn from this place, you understand? And some of those looking for the fruit of the womb would also like to come here to learn so many things, and we all will love to learn a lot. But the thing is, when you come in here, I'm telling you this thing, if you do it, you will remember me, When you are coming here, you are here, before starting any program, you just drop a prayer, even if it's just 5 seconds, even if it's 2 people that is here. Open prayer and close the prayer. Just do it. It will help a lot.
Absolutely. I agree with you. In fact, 1000%. I only do my own prayer before I come live. But before I start the program, I don't do like. But I agree with you. I'll take that in a very good faith, and I'm happy that you are bringing it up, and I'm going to start doing it.
It's
from
very
tomorrow
important.
once I come live.
You will see, you will remind me of, you will even say that it will even go more viral than this, because so many women, we are on social media, a lot of people really want this. You will see it. There will be a lot of changes. Even the people reporting it will even change, But nevertheless, we pray. Heavenly Father, we come to pray.
Zara, wait, please, just a minute. Yeah. Just a minute. I want to sincerely thank you for bringing this up. All that I do is that when I'm coming live, I just pray, and when I come live, I start the program once I have some few people. So this input from you is very, very laudable, and I want to appreciate you. I'm sure that is why you are the one I eventually pick out of the lot, because God wants to tell me something through you. So I don't take that suggestion for granted at all. I only pray and I come and start the program. But when I come before I start, I don't pray. It is most of the time when I finish, because I felt I pray before I came. So when I'm going, then we pray. And even that, I don't do it all the time. So thank you so much for the wake-up call. I agree with you, and I'm going to work on that, okay?
Okay.
Thank you. So pray with us. Please go ahead and pray with us. You are muted, please. What happened? Zara, please, you've gone off. You've gone off. Zara, can you send me a mic again? Is it your network? What happened? What's happened? Zara, send a request again if you are still here. The enemy doesn't want that prayer, but we'll pray before we go to the normal. Okay, Denise is here. Denise.
Oh no.
Yes, Denise. What is happening? Zara, are you here? Are you here, Zara? If you are here, Zara, send another request. I hope it's not your phone that has blacked out. Zara, if you are here, please send me another request. Let me bring you back up. Either than that, any other person here who want to pray with us and we end the session, please send a request. Somebody says Zara is an angel, so she just came to deliver a message, which I've taken. Zara, they say you are an angel. Of course, you could be an angel, I agree. Any other person here who want to pray with us? Zara, I'm still looking around. If you are here, send me another request and come. Either than that, okay, now Vika, you've raised your hand. Thank you. Let me bring you up. Okay, now, please.
Yeah, hello?
Yes, please.
Okay. So, can I go on?
Yes, please, go ahead.
Okay, so, King of glory, Lord of Lord, we give you all the glory, we give you all the praise. We say thank you for how far you brought this program, and thank you for this angel you've actually brought to us women to help. Father, we pray in Jesus' name, and we commit this beautiful soul you've given us in your hands. We pray in Jesus' name for your protection, for your direction, for your guardians, for your great securities over him, against all odds in the name of Jesus. Father, we ask in Jesus' name that you take control of this program. Father, wherever you want to lead it to, Father, let your name be glorified. We thank you for being the beginning and the end of today's session, and we know that other sessions that are supposed to come out, Father, you will take control, you will take over, and all the glory will be yours. We thank you for using this doctor to bless other lives, and we thank you that you are going to use him mightily in the lives of people. And we thank you that, oh God, you will set a table before him in presence of his enemies, and the enemy is going to be put to shame. We thank you and we bless you, Father, in Jesus' name. Amen.
Amen. Thank you, everyone. God richly bless you, Vicky. Thank you so much for that amazing prayer. God richly bless you. Guys, thank everybody and keep coming. Trust me. Here is a powerhouse of free medical knowledge. And I appreciate all of you. And I have requests for all of you. Please, anytime you go on your knee, whether you're a Muslim, you're a Christian, pray and you remember me. You remember the name Dr. Felix. Please, when you are saying a prayer, say one for me. Okay? Remember me. God bless you. I'll see you all. Thank you for the likes. Thank you for the shares. Thank you for the gift. Thank you for the subscription and everything. God bless you. I'll see you tomorrow. Have a lovely day. Bye-bye.
Let's comment, yes. Comment.
And then Johan just said that he visited what did you say? Is it a fortune teller or something like that? So that is from the Torah as well as in the Old Testament. It is true God did not like sacrifice of humans. That is sacrifice.